So with that, I'm going to move forward with a very dear friend of ours. We've gotten to know her over the last 3 years. She's going to be our keynote speaker. It's Dr. Jennifer Cope. She's a medical epidemiologist from the CDC. Dr. Cope.
Good morning. I want to thank the Smelskis and all the planners for inviting me back as your keynote speaker again this year. And for this year's talk, I'd like to talk about an investigation from last summer in which we identified, unfortunately, yet another unique type of water exposure that led to a young woman becoming infected with Naegleria fowleri. So the objectives of my talk this morning will be to understand the current epidemiology of PAM in the United States and determine the rationale, what we kind of think through at CDC when we consider environmental water sampling when a PAM case is reported to us. And then I'll spend the rest of the talk describing the investigation last June of the PAM case and how it was linked to water exposure in an artificial whitewater river. So I do want to spend a little time giving an overview and review. I know many of you have attended before and are well aware of Naegleria fowleri and the disease it causes. But for those who have not been here before, or you just need a little review, Naegleria fowleri causes primary amoebic meningoencephalitis, or PAM, which is a serious brain infection. There have been 143 cases in the United States that have been reported to CDC since 1962. It's a highly fatal infection with only 4 known US survivors. It's an acute disease with a median time from the exposure to death of 10 days. Historically, most infections have occurred in people who swam in a lake or river in a southern tier state. The infection occurs when water that contains the amoeba goes up the nose and into the brain. So this figure shows the number of PAM cases on the x-axis by month of the year on the bottom y-axis, and it's color-coded by the type of water exposure that caused the infection. And so here you can clearly see that infections predominantly occur in the summer months, with the peaks in July and August, and that lake, pond, and reservoir water exposures, which are colored in the green color, are the most common type of water exposure leading to infection. This map shows the states in which PAM cases have occurred, with the darker red color indicating the higher numbers of cases. This map is created by determining the state in which the water exposure occurred and not necessarily the state of residence of the patient. So for example, several of the Florida cases occurred in people who resided in northern states but were vacationing in Florida at the time of the water exposure, and so those are counted as Florida cases. Florida and Texas have reported the most cases, each with 35. So before I get into the story of the whitewater PAM case from last year, I wanted to provide a little general background about when CDC considers doing an environmental investigation for a PAM case. When a PAM case gets reported to CDC and we determine that the water exposure occurred in a natural body of water, such as a lake, pond, or river, we generally do not recommend doing water sampling in those cases, since Naegleria is expected to be found in those types of water, and there's no remediation that can be done to that type of water body, such as chlorine treatment. However, if a new type of water exposure is identified, or if tap water or drinking water is potentially involved, we will consider an environmental investigation, including water sampling. This was the case in 2011 with the neti pot cases in Louisiana, and the 2013 backyard water slide case that also occurred in Louisiana. Another note to consider is that CDC can only investigate at the invitation of the state or local health jurisdiction. So while we can recommend that water sampling be done, if the state or local health department does not necessarily agree, then CDC cannot go in to investigate. So moving on to last summer's case. On Saturday afternoon, June 18th, CDC was contacted by a critical care physician in Columbus, Ohio, who was caring for a critically ill 18-year-old female with meningitis who had been admitted to the hospital the day before. Treatment for other more common causes of meningitis had so far been ineffective. Possible amoeba had been seen on the wet mount of the spinal fluid. Given the strong possibility of PAM, miltefosine was shipped from CDC and arrived later that evening in Columbus, when it was started along with the other recommended drugs for PAM treatment. Despite these measures, the patient died the following morning. The following Tuesday, the CSF arrived at CDC, and our lab was able to confirm the presence of Naegleria fowleri in the CSF by PCR. What made this case different was when we started asking our usual questions about water exposures that the patient had in the days before becoming ill. We were told that she'd been on a youth choir trip to several states that included North Carolina, and on one of their days off, they had spent the day at the U.S. National Whitewater Center. We had not previously heard of this, and so with a Google search, we were able to learn a little bit more about what the Whitewater Center was. And we were intrigued to learn that it was an artificial, recirculating whitewater river that was open to the public, but it was also popular as a training site for Olympic kayakers. We were also a little perplexed because PAM cases had never been reported before in association with whitewater rafting. And we assumed that most natural whitewater rivers tend to be cold mountain rivers and streams, and that this is why we didn't typically hear about PAM cases associated with it. Because of this unique water exposure and the fact that we knew nothing about the risks of Naegleria fowleri, of Naegleria exposure in an artificial whitewater river, we assembled a team that was comprised of myself and 2 members of our environmental microbiology lab who are experts in water sampling. At the invitation of the North Carolina Department of Health, we traveled to Charlotte, North Carolina to conduct a site visit of the U.S. National Whitewater Center and take water and other environmental samples. So a little bit about this center. The U.S. National Whitewater Center is located in Charlotte, North Carolina on 1,100 acres near the Catawba River. Activities offered include whitewater rafting and kayaking, flat water kayaking, stand-up paddleboarding, rock climbing, zip lines, ropes courses, a canopy tour, and mountain biking. Whitewater activities take place in a recirculating artificial whitewater feature. The facility is not subject to North Carolina public swimming pool laws and rules. So here's a facility map showing the locations and types of activities offered. This is the map you receive in the brochure when you pay your admission fee. The main feature is the Whitewater River that's shown in blue in the center of this map. Nearby, but not connected to, is the Catawba River, which is accessible by a trail from the main whitewater area. On the river, the center has what they call the flatwater dock, where patrons can kayak or use stand-up paddle boards, which are pictured on the right. Early in the investigation, it was unknown whether the patient had participated in activities here at the flatwater dock, and if she could have contracted Naegleria from the natural river source, which would not necessarily be surprising. However, we were eventually able to determine that the patient's only water exposure occurred in the artificial whitewater river. The channel structures for the whitewater feature are poured concrete with a geobarrier and a water barrier membrane below the concrete to prevent mixing with groundwater. Water for filling and maintaining water levels in the whitewater feature is obtained from on-site wells and the county municipal water. At no place is river water introduced into the system. Storm drains and ground drainage around the site are graded to minimize runoff from entering the system. However, as you can see from these photos, the channels are open, so water levels do increase during rainstorms. The whitewater feature contains approximately 12 million gallons of water at any time. 7 pumps are available, with 1 kept in reserve, and 6 are usually used to lift the water approximately 21 feet to an upper pond, and then water then flows down by gravity down one of 2 channels. An 8th pump separate from those that create the water flow down the channels, pulls the water from the lower pond into a filtration unit. The flow of this pump is intended to bring the total volume of the system through filtration once every 24 hours. There are 4 filters consisting of interlocking plastic discs with a pore size of 200 microns. Monitors automatically backwash the filters when the pressure gradient on each side of the filter exceeds a preset value. After filtration, the water is forced through an ultraviolet disinfection point. 18 ultraviolet tubes project through a 2-foot section of pipe. From the filter unit, water is then discharged to the upper pond. Chlorine was only added as a disinfectant only when the coliform counts were trending upward or algae growth had visibly increased. Chlorine was added as a liquid to water in the upper pond. The facility had a contract with a commercial laboratory to perform weekly testing. Fecal coliform counts, turbidity, pH, temperature, and a number of heavy metals were measured as part of that weekly testing. When we first arrived at the Whitewater Center, we sat down with the director and the center staff and talked for nearly 2 hours about how the center is operated. At one point, I recall they mentioned that they had a quote-unquote algae problem, and I remember thinking that this was probably something significant to note. They talked about how they had to constantly scrub down the sides of the channels to keep the algae from building up. And then when we got a chance to go outside and look around, we were able to observe this brown, slimy scum layer adhering to the sides of the channels, as seen here in this photo. After we took a look around, my lab colleagues got to work identifying locations and collecting water samples. And those locations where we sampled are denoted here on this map by the numbers. We took several types of samples. The simplest type would be what we call a grab sample, which is shown in the upper right. This is simply a 1-liter bottle that is dipped into the water, or in some cases down into the sediment to collect both water and then what's on the bottom. A drawback to this type of sample is that it's a relatively small amount when you consider that the total amount in the water was nearly 12 million gallons. That's where the ultrafilter comes in, and this is pictured on the lower right. And for the clinicians in the room, this is actually a kidney dialysis filter that has been repurposed to filter hundreds of gallons of water using a pump. This allows us to sample much more water because all we have to do is take back the filter to the lab instead of hundreds of gallons of water. This allows us to sample much more water, and then all we have to do is take back the filter, which has hopefully captured the bugs of interest in its membranes. A third kind of specimen is a surface swab specimen. The photo on the upper left shows the sponge used to collect the specimen, and the bottom left shows Dr. Murphy from our lab using the swab inside a frame with a standard size to collect biofilm from a rock in one of the channels. In the upper middle picture, you see a photo of an offshoot of the upper pond, which we noted that, and the staff told us that a lot of accumulation occurred here of sediment. And on the bottom middle, you'll see a picture of a grab sample that was collected from that upper pond area, showing this very thick, murky material that was present there. As part of the environmental investigation, basic water quality measurements were taken, including temperature, turbidity, and chlorine residual levels. We found that the water temperature in both the Whitewater River and the Catawba River were greater than 80 degrees Fahrenheit. Turbidity, which is the measure of the cloudiness or haziness of a fluid, was high in the Whitewater River, and it was actually higher than it was in the Catawba River. Free chlorine was measured in the Whitewater River and was found to be low, meaning it did not contain sufficient free chlorine residual for disinfection. Turbidity in the Whitewater River lower pond was too high for the water to maintain a sufficient chlorine residual because all that organic matter that makes the water turbid consumes the free chlorine. So in total, we collected 11 samples from the Whitewater River. And I know there's a lot on this table, but I will just have you note the multiple results that say positive. 4 of those were filter backwash from each of the 4 filter pods, 2 from the bottom pond, a grab sample and an ultrafilter large volume sample, 2 small volume grab samples from the top pond, surface swabs from the channel and boat loading ramp, and some submerged plant material from the channel. These were taken back to the CDC Environmental Microbiology Laboratory and processed. PCR was done directly on all the samples to see if Naegleria fowleri DNA was present. Additionally, the water samples were also plated on media and placed in conditions conducive to growing Naegleria. This process would allow for even small amounts of Naegleria that might not be detectable by direct PCR to grow and then become detectable, and would also tell us that the Naegleria detected PCR was actually from living Naegleria and not just bits of DNA from dead organisms. All of these samples were positive for Naegleria fowleri, both when tested directly by PCR and after they were cultured and then tested again. While our PCR test is technically not a quantitative test, meaning it just tells us the presence or absence and not an actual level, we can say that the values we obtained on the direct PCR test indicated levels of Naegleria that were typically only seen on Naegleria cultures and not what we typically see on direct PCR from water samples. So that told us that these were pretty high levels. And these are the sampling results from the Catawba River. We took 5 samples from the flatwater dock area on the Catawba River, including small volume grab samples, a large volume ultrafilter sample, sediment, and surface swabs. Only the sediment sample was positive after it was grown in culture. As you might imagine, this investigation made a lot of the local headlines around the time this was happening. The lab results really made us feel uncomfortable about the Whitewater Center remaining open as it was with no changes made to their water treatment systems. We had never seen these levels of Naegleria growth in water samples before. We concluded that the water treatment systems in place were not effective for controlling the growth of Naegleria in this warm, turbid water of the whitewater channels. So after discussions with the local and state public health officials, and then directly with the Whitewater Center, the Whitewater Center voluntarily shut down on June 24th. Over the next month or so, we held numerous conference calls with the state and local health departments about what should be done. And while my group at CDC is experts in waterborne diseases, and we do have some knowledge about water treatment, we are certainly not engineers, and so we recommended that they have experts in the treatment of large water systems to come evaluate the Whitewater Center and make recommendations for remediation. So in the end, the Whitewater feature was drained, cleaned, and then refilled. The Whitewater Center opened later that summer with a modified filtration system, a new ozonation system, and a new automated chlorine injection system, with the goal of maintaining a free chlorine level of 0.5 parts per million. Additionally, the local county board of health adopted new rules to govern recreational whitewater systems. These rules included maintaining free chlorine levels, daily water quality monitoring, and documentation and removal of organic accumulation. This investigation really highlighted for us some issues around these newer types of recreational water venues. As more recreational water venues are constructed that do not meet traditional definitions of swimming pools or water parks, such as artificial whitewater rivers and cable parks, public health authorities and other state and local regulatory bodies will be required to make difficult decisions in the absence of scientific data to determine how to best regulate these venues in order to protect the public's health. I do want to take a minute to acknowledge several groups that were part of this investigation. The staff we worked with at the North Carolina Department of Health and Human Services, the Mecklenburg County Health Department, which is the county where Charlotte is, as well as our colleagues in Ohio at the Department of Health, and in Franklin County, where Columbus is, which were instrumental in determining the patient's water exposures. And then my colleagues in the Waterbourne Disease Prevention Branch, Jen Murphy and Amy Kaler in the Environmental Microbiology Laboratory, and then my colleagues from the Free Living Amoeba and Intestinal Amoebas Lab, Dr. Ibni Ali and Shantanu Roy. Thank you. I think if I do have a few moments to take questions, if there are any. And there's microphones on the sides.
Yes, I forgot to point that out. So in the two outer aisles, we have two microphones. So if anybody would like to stand up and ask Dr. Cope a question, please feel free to do so.
This microphone, oh, there it is. Excellent presentation, Dr. Cope.
Thank you.
So what is addressed in this presentation is health protection. It is water as the issue, and health protection, which is a part of the public health response. So that industry plays a role in the public health response, and it is regulatory public health as an authority that can also come in there and provide guidance. And my question is, I believe there was also issues with water systems in municipalities in the state of Louisiana within the last year or so, and previous cases that have involved water systems. And you know, could you comment on that, and whether, you know, the standards have either lapsed in some instances, or we just have had upgrades to the standards for water systems? Thank you.
Okay, so I think you're referring to cases that have occurred in Louisiana. Starting in 2011, there were the 2 PAM cases identified that were found to be associated with the use of neti pots, which is a device used to clean out the sinus passages. And those patients were using tap water without any additional treatment. And then subsequently, there was a case identified in 2013 of a child who had played on a backyard slip and slide that had used water from the household tap as well. And that case occurred in the same parish as one of the neti pot cases from 2011. And so we did end up, that was another instance where CDC, as I mentioned, was very interested in doing water sampling because of the type of water exposure and the fact that it's drinking water, which is a regulated water, you know, has strict regulations on what needs to be done for drinking water. So in 2013, we did find Naegleria fowleri in the municipal drinking water system in one of the parishes. And as a result of that, and we found in conjunction with that, low levels of free chlorine in those drinking water systems. And really all we have to go on, this is unprecedented. This is something that had not previously been found, although there's probably been Naegleria in drinking water systems for well before we found it. The only precedent, the only thing we had to go on was the experience of the Australians in the early 80s, when they had several cases associated with the use of drinking water. And in Australia, in this part of Australia, their drinking water came from a river, and it was pumped for hundreds of miles overland in overland pipes they were overland, not buried in the ground. And as you can imagine, the interior of Australia gets quite warm, and so this water was very warm. And by the time it reached the homes, it was warm, and the chlorine that had been added had completely dissipated. And so they had cases associated with the use of drinking water, and their response was to start doing some testing and boosting chlorine levels. So they would add booster stations to closer to where the water was being used in the homes, so that by the time it reached the homes, it still had adequate levels of chlorine. And that's really the only experience we had to go on. As you heard from Steve, there's not a lot of research on Naegleria fowleri, and so we really only had to go on their experience when we identified this problem in Louisiana. And so since that time, Louisiana is really on the forefront of addressing this issue in drinking water. They now have regulations that require 0.5 parts per million of residual disinfectant in their water distribution systems. And that, to my knowledge, those regulations actually, there are overarching federal regulations at the EPA level, but there is a lot of leeway for what states require at the state level. And as far as I know, Louisiana's really has one of the highest and most stringent requirements for the amount of residual disinfectant that's required to be in drinking water as a result of these cases. I think these cases just point out some of the overarching issues we face with water in our drinking water in this country. We are fortunate to live in a country that has safe drinking water. So for the most part, we do not worry about getting diarrheal disease from our drinking water in this country, which is not the case in a good chunk of the rest of the world. So I think it's led to some complacency as far as, we just assume our drinking water is safe, and we assume it's safe for all uses, whether it's putting it in a neti pot or using it on a backyard slip and slide. And I think we need to consider when we're using drinking water for other things, other than preparing food and drinking it, that there are, we're learning more and more about microorganisms that just naturally live in water. That includes Naegleria fowleri, but it includes a lot of other things. And just remembering that water is not, even our drinking water is not sterile. And so when you're using water in other ways, you probably should consider what else might be in the water. And certainly if you're a neti pot user, and I'm all for using neti pots if you have sinus issues, but just consider what needs to be done to that water, whether it's boiling it and letting it cool, or if it's buying distilled or sterile water from the store for use in your neti pot. So that was a very long answer, but I think it's a complex issue that we're addressing.
I have a question.
Mm-hmm.
It is my understanding that not all states are obliged or mandated to report Naegleria to CDC. So I have 3 grandchildren in California,
Mm-hmm.
and this is very concerning because they always go to the lakes. And I don't know if it's rumors, but that there have been events in California that were discovered to be Naegleria. What is the move for CDC or other health departments to move towards reporting Naegleria so that people will be more aware and protect grandchildren and children, as I have?
So the reporting issue is complex. I believe that any PAM case that is diagnosed is actually brought to the attention of CDC, regardless of requirements. And that's because it is something most people are not familiar with. It's scary, And when it's identified by a hospital or is brought to the attention of a public health department, they're going to seek out assistance. And so I think when a PAM case is diagnosed or at least suspected, I think public health, whether that's CDC or the state or local level, is brought into the conversation. What I think is potentially being missed is cases of meningitis that go undiagnosed. There are a lot of, when it comes to neurologic infections, there's a lot that goes undiagnosed because there's so many yet unidentified viruses and other organisms that cause these diseases and infections that we just don't know enough, or in our testing capacity is just not there yet either. So I do think there are PAM cases that go undiagnosed, and if they go undiagnosed, then we can't hear about them because no one knows to report them. Yeah, I think anyone that is suspected or diagnosed, I do think does come to the attention of CDC.
Hi, Jennifer.
Hi.
Great presentation. You kind of touched on this at the end, but one of the questions that I had was, I think about this case last summer that was involved in this whitewater facility, and I think back a few years ago in Arkansas, there's been 2 cases in Arkansas that were associated with a kind of recreational water park, which was really not much more than a glorified swimming hole. But is this beginning to create a shift nationally in how we sort of oversee these type of facilities? It sounded like locally in Charlotte they were starting to step up what they were requiring, but is this creating a shift nationally in how these parks are expected to be managed and how their water is supposed to be maintained?
Yeah, no, we actually recently just published this investigation, and as part of that, we actually included a table that summarizes PAM cases that occurred in water bodies that we loosely called that they had been modified in some way, and the park in Little Rock was included in that. And I say loosely because it involves a number of different things. We kind of categorize this very generally, but it includes the whitewater case. But in Arkansas, as we understood it, there was some modifications being made, maybe a little chlorine or a little something added to just maybe help with the clarity of the water, but certainly not at levels that was killing off any organisms. We included, natural water bodies that have had just, slides added to it, or these tow cable parks where I think, even if they look like a lake and you assume, oh, it looks like a lake, it's not treated, people are interacting with this water in ways that are different than if they just went to a beach on a lake, where you're just wading in, or maybe you're swimming, maybe the kids are roughhousing a bit in the water, but certainly not water skiing or wakeboarding. And when you wipe out, you're going, at a very fast rate where water is certainly being forced up the nose. And so we took the opportunity to kind of summarize some of these cases that occurred in water bodies where there's been some alteration or some different way that people interact with the water that could have potentially put them at higher risk for acquiring Naegleria. As far as regulating them and then what's happening nationally, certainly after this case occurred, we were being contacted. We actually were contacted by at least one facility that was only in the planning stages. It hadn't been built yet, and so they had heard about this. It was going to be something, I think along the lines of a cable park, where they were going to use like rainwater runoff or something as the water source, which certainly raised some concerns among us about the safety of that water. So I think this brought attention. I think it's definitely something I think certainly people that are building these parks were paying attention, at least at that time. But I think it's going to take a little more time to sort it out. I mean, even regulation of swimming pools and water parks is is complex. There's actually no overarching federal regulation of swimming pools and water parks. That all is occurring at the state and local level as well. We do have an effort at CDC called the Model Aquatic Health Code to try to standardize and make it easier so that every state and local jurisdiction doesn't have to reinvent the wheel. And that is, it's all science-based. So there is that effort, and I do see the possibility of starting to incorporate some of those issues. This aquatic health code is updated every other year with new science and new issues, and so I do think that's a way to potentially start to address some of these issues of these venues that just don't meet our traditional definitions.
Dr. Cope,
Oh, sorry.
I have a question. Are there any states that have chosen to opt out of assistance from the CDC, and could you elaborate on that? You said it was an option for states to cooperate with the CDC.
That was just, trying to paint a picture of what how CDC interacts with state and local health departments. CDC, unlike some of our sister organizations like FDA, is not a regulatory agency. We are a consultation agency, and so when states don't necessarily, if we're not going to go in and do an investigation, that's usually after much discussion, and so it's not usually a refusal. It's just after many discussions and just weighing the pros and cons, because the state, at the state and local level, they're the ones on the ground, and they know the issues and they know the obstacles, and so we do, and they're the ones with the actual regulatory authority when it comes to public health, and so it is, in consultation with us that we come to those decisions. Thank you, and I'll be around for more questions if throughout the day.
Thank you, Dr. Cope.